Hey guys, Dr. Teresa Larson here with MovementRx. So today I'm talking about what is physical therapy and how to pick the appropriate physical therapist or practitioner. How do you know if they're for you? So here's the thing. A lot of you guys like to lift weights and like to be active. So the important thing is that your physical therapist or practitioner walks their talk as well and is active. But physical therapy in general, so this is what it is. It is a movement-based treatment that focuses on treating someone for helping them improve movement. So we call them movement dysfunctions. So we treat movement dysfunctions. We are designed as movement specialists to look at movement on a very large scale and small scale, so parts and patterns of movement, and figure out what is going on with someone's movement so they can, one, get past their plateau in training and or fix injuries. So we do both. We help someone with the wellness side, just improving movement, and then the treatment side with an injury. So don't look at the WebMD definition because it mostly just talks about PTs treat pain. They use heat and modalities to treat pain. No, we do a lot more than that. Again, we're movement specialists. The way we treat it, so we coach movement, but we also use something called manual therapy, joint mobilization or manipulation, depending on what state you're in, to help fix movement. We use soft tissue techniques like active release, or we use hawk grips, or we teach self-mobilizations with lacrosse balls and barbells and bands to help fix soft tissue restrictions. We also do something called neuromuscular reeducation, so neuro-re-ed. So when we fix the mobility in the joint, fix the mobility in the soft tissue, we then teach them how to move appropriately, and it might include appropriate tissue firing and timing, which is very essential to getting you back to 100%. Okay, so here's the thing. You need to go see someone. You want to see a physical therapist or a practitioner. How do you pick them? Well, one, they should be able to treat you for an hour. Okay, first of all, if someone is seeing someone 4 to 6 people an hour, that's not something to brag about, because how can you actually treat the cause of dysfunction if you're treating that many people? So know that if you see a practitioner and they see 4 to 6 people an hour, may not be the person for you. 1 hour, their quality time, working with you. 2, it's got to be hands-on. Okay? It's none of this, oh, go see someone who's in high school and teach you how to exercise. It's hands-on, manual work, soft tissue work, and them teaching you how to move more efficiently. So again, hour treatment, hands-on. The third thing is, know what's behind their name. So a lot of doctors and practitioners have many letters behind their name. It's like alphabet soup. So that alphabet soup, know what it means. So if someone has an OCS behind their name, that's an orthopedic clinical specialist. Sometimes with physical therapists, they have things behind their name that starts with a G. Geriatric specialist may not be the person for you. If it's something that you don't understand, may not be the person for you. Okay, so make sure if you're a CrossFitter, it would help if they were a CrossFit coach or they trained in CrossFit themselves. If you're an obstacle racer, it would help if someone knows what kind of movements you do with obstacle racing. So maybe having gone to one of the obstacle racing courses would be something you'd want to look for. If it's a joint issue, looking for someone who's an orthopedic specialist or a movement specialist, which is what physical therapists are supposed to be. And then the fourth thing, okay, is do they snatch? Okay, ask your practitioner, your physical therapist, how much do they snatch? And or how much they deadlift, right? If they don't know what that movement is, that's a problem. Okay, all of you guys that work with us and have worked with Mobility Wide, you guys are using strength and conditioning as your basis to train for a sport, okay? So if your PT does not know what a snatch is or a deadlift, then they're probably going to tell you to stop doing it because they know nothing about it. That's a very common response, and that's not okay. We should know how, as a PT, should know how to teach you to do it appropriately, okay? So I'm not going for a 1-rep max here, but and that is it.